Welcome everyone to our webinar today. We are New York State Office for New Americans based in Santa Utica, New York, and I'm Alesia Baranava, the project coordinator of the program. The New York State Office for New Americans program helps new Americans fully participate in New York State civic and economic life. Our commitment is to foster a welcoming environment for new American families and facilitate their success in New York State by providing various supports and services. It is our mission to prepare the new Americans for naturalization and assist new Americans in preparing for the application process, as well as offering ESL classes and free legal consultations on a monthly basis. Among other things, we hold educational workshops like the one we have today. And today we are holding a workshop in collaboration with Mohawk Valley Health System. In today's webinar, we will be discussing COVID-19 vaccine, and Dr. Ken Hall, the Chief Physician Executive, will help us with that. And just a few reminders before we get started, please feel free to ask questions at any point during the presentation or to put them in a chat box. And with that, we will open today's webinar. And I'm going to hide myself and mute yourself and introduce Dr. Ken Hall to the floor. Welcome, Doctor. Please feel free to ask any questions during the presentation or put them in a chat box, and we'll make sure to address them at the end of the presentation. And here I'm going to hide myself and mute myself and introduce Dr. Ken Hall to the floor. Welcome, Doctor.
So good morning, and thank you for having me. So my name is Kent Hall, and I am the Chief Physician Executive for the Mohawk Valley Health System. And what I wanted to talk to you about this morning was really about COVID-19, something that we've been living with for the last year, and ways that we can fight this disease and this pandemic. Specifically, I want to talk about not only ways to prevent it, but also the vaccines that are here, and more are coming, and that will help us get back to a more normal way of life. Lots of people have questions about this disease and about the vaccines. They're appropriate questions, and it's good to ask these questions, and it's good to look for answers. So I hope that everybody will avail themselves of that. So first, a little bit about COVID-19 itself. The disease, COVID-19, is caused by a virus. The official name of the virus is SARS-CoV-2. It is a coronavirus. Coronaviruses are a class of viruses that some of which cause things like the common cold. Some of them have caused serious diseases like Middle Eastern respiratory syndrome, or the first SARS, the serious adult respiratory disease. The infection with SARS-CoV-2 can result in a range of illnesses, or a range of symptoms. It can be anywhere from very mild to almost nothing at all, to very severe illness, which can require you to be in the hospital, potentially to be in the intensive care unit, or potentially even to die. About 30% of people, that's a rough estimate, nobody knows the exact number, but about 30% is the closest estimate of people who are infected with the SARS-CoV-2 virus who do not have any symptoms at all. No one can predict how severe any individual person's illness will be when they get infected. There are certain things that will predispose to having more severe illnesses, such as an older age, or medical conditions like diabetes or obesity, cancer, heart disease, just to name a few. But there are people who have been in their 20s and who have not had any of these and have still ended up being in the intensive care unit, and unfortunately, some of them have actually died. So there is no absolute with this disease. I want to talk a little bit about basically some basics for it. So basically, probably the most important thing that we can do, as we've been told since childhood, an ounce of prevention is worth a pound of cure. So really preventing the disease is probably the best thing. And there are things that we know, not only from this pandemic, but from infectious diseases in general, that will help to stem the spread of infectious diseases. For this particular disease, the things that we know work include wearing a mask that covers your mouth and your nose. That protects you. It also protects people around you. So it's very important as a good community member that you want to do that. You want to avoid close contact with others, especially others that you don't have frequent contact with, so people not in your household or not in what I term your own personal bubble. By staying away or avoiding personal or close contact, that means staying at least 6 feet away. That has actually been shown to be beneficial. Further away is better, but 6 feet is really kind of what we look for. You want to avoid crowds, especially crowds where you are in an enclosed space for an extended period of time. You want to be sure that you're washing your hands with soap and water or with hand sanitizer frequently, because the virus can get on your hands. And then if you move your hands up to your mouth or to your eyes, that is a way that it can get into your body. And therefore you want to avoid touching your eyes or your hands. You want to clean surfaces fairly frequently in order to minimize the opportunity for the virus to be there. That is not the predominant way that this virus is spread, but it is a way. And finally, you want to, now that we have vaccines and more coming down the pike, you want to get the vaccine as quickly as you are able to. So in talking a little bit about the vaccines, okay, the COVID-19 vaccination is a way to build protection within your body. Okay, so getting the virus, so being infected, will cause your body to fight it off. You will develop what's called an immune response. Your body will make the antibodies, which are basically the weapons that your body uses to fight off this virus. And it does provide some degree of what's called natural immunity. But experts don't know how long this protection will last. And obviously, if you get infected with the virus, then you risk getting severe illness and possibly death, which obviously is much worse than if you take the vaccine. The COVID vaccine, I think it's probably the most important thing, foundational thing that we can take from this, is that getting the vaccine does not give you the disease. It is not a live virus vaccine that actually gives a small amount of the live virus into you. It is a genetic part of the virus that your body then recognizes as being foreign and develops the immune response, makes the antibodies to fight it, but it does not give you the disease itself. It is easy to be confused because of all the information that is circulating, some of which may be conflicting. So I will tell you that a good source is the Centers for Disease Control and Prevention, or the CDC website. That's www.cdc.gov. They have facts that can help you to understand this and can really cut through some of the myths. So some of the myths, number one, just as we were talking about, is that the vaccines can give you COVID-19. That is not true. It is that people who have gotten sick with COVID-19 may still benefit from getting the vaccine. So simply because you've gotten the disease does not mean that you should not get, or that you should avoid getting vaccinated. In fact, it is important that that group of people also be vaccinated, because getting vaccinated can help people from getting sick and it can also boost your immune response if you did have a natural, if you did contract the disease. COVID-19 vaccines will not cause you to test positive if you are tested for the virus, because the current tests actually look for the virus itself. They do not look for your body's response to it. Vaccines are artificially made from pieces of the virus itself. They are not made from animal products like pork or pork products or anything like that. They're not made from eggs. There has been no fetal tissue that has been used to make the COVID-19 vaccines. And again, if you want more information, there's huge amount of information that is available on the CDC website, and I really encourage you to go there so that you can get more of your questions answered. So another question that's often answered is, so how safe are these vaccines? So the COVID-19 vaccines that have been developed and are being developed are held to the same safety standards as any other routine vaccines. So the vaccines that children get when they're growing up, ones that adults get when they go to college, they are all held to the same standards. There are several expert and independent groups that evaluate the safety of vaccines that are given to people in the United States. So before any vaccine receives authorization or approval, it goes through the same process. First, there are studies that are done, usually involving, thousands, tens of thousands of people. That data is all collected and it is given to what's called the Advisory Committee on Immunization Practices, or ACIP, which is a part of, which is an independent group that that is comprised of experts and looks at the data and then makes a recommendation. So well, first of all, the data that it looks at is not just how well did the vaccine perform, but also how safe was it. One of the reasons why these studies include so many people is because you want to really look at it in a large population, because that will give you the information on whether it is truly safe for people, because something that happens only 1 in 1,000 times, if you only test it on 500, then you may not see that effect. Whereas if you test it on 50,000, then you are much more likely to. The Advisory Committee on the Immunization Practices then makes a recommendation which goes to the Food and Drug Administration, or the FDA. The FDA also looks at the data. So the ACIP looks at it, then the FDA looks at it also. And based on the recommendation of the ACIP and their own internal review, they will give the vaccine a thumbs up or a thumbs down. So in this case, they have given 2 a thumbs up, the Pfizer and the Moderna vaccine, and they're actually looking at the Johnson & Johnson vaccine right now. The ACIP and the FDA have very qualified scientific and clinical experts with minimal to no conflicts of interest when they review the data. And when they do have a conflict of interest, then they actually recuse themselves. So if you read media reports, you may see that the vote of the ACIP was 19-0 with 1 recusal or 1 abstaining. And that's because that person said, I participated in this, or I talked to the company about it, and so I don't feel that I should give my recommendation or my vote on it. Existing symptoms. So we do look at the vaccines and monitor them not only when they're approved or before they're approved, but afterwards. And there are existing symptoms that are in place that will continue to look at the virus or at what happens after people are vaccinated. The CDC has 2. One is called vSafe, which is a smartphone-based after vaccination health tracker that you actually enter information into. You're prompted, you get a text message, and you're prompted to actually give the information. And if you answer positive that you are having some kind of a reaction or some ill effects, which may or may not be related to the vaccine, then you'll be contacted so that people can better understand that. And then there is also the Vaccine Adverse Event Reporting System, or VAERS, which is a national system that's used by the FDA to look at the vaccine after effects. So with the COVID-19 vaccination, it will help to protect you. You will be getting a COVID-19 vaccine will help to create an immune response. So that is basically your body's defense mechanisms against the virus without you actually having to experience the illness itself. Based on what is known about vaccines for other diseases, as well as what we have learned through the trials of developing these vaccines, then we believe that the COVID-19 vaccine should help you from getting seriously ill, even if you do get exposed to COVID-19. What we don't know, some of the things that we don't know, is that if you are exposed and you may not get sick, but you may still have the virus like in your nose, in your nasal cavity or something like that. So we don't fully understand or have full knowledge about whether you might be able to transmit it to other people, which is one of the reasons why the recommendation, even after vaccination at this time, is that you should still wear a mask and still practice all those safe practices we talked about before. That doesn't mean as we learn more, it may very well be that we'll learn that that isn't as much of a problem, and people who have been vaccinated may not have to wear a mask and do those things. But right now, we just don't have enough of that information. So basically, what I want you to remember is that COVID-19 vaccines are safe and effective. They do not give you the disease. They teach your body how to fight the virus before it makes you sick. Side effects are normal reactions to the immunization, and the vaccines have been endorsed basically by all major medical organizations. They, even the Pope has come out to say that people should get vaccinated. So it is truly something that is understood. So the other thing that people get concerned about is side effects. Okay, so what are some of the side effects when you get vaccinated? What are some of the side effects that you may feel? Okay, basically the common ones, the most common ones, number one, are pain and swelling at the site of the injection. That usually is a little bit of soreness, a little bit of redness. It usually lasts about 1 to 3 or 4 days. It's usually worse the second day, the day after you get the vaccine, and then it gets better gradually after that. Some people get fevers or chills. Some people feel tired, and some people get headaches. Most of those fade away after the first day, and most of them are worse with the second dose of the vaccine as opposed to the first dose. So the first dose, you may not get much of anything. In the second dose, you may notice that your arm is a little sore, or that you're getting some fevers or chills or things like that. Again, they tend to fade away fairly quickly. So I will say that COVID-19, the vaccination, is an important tool to help us stop the pandemic, but it is only one tool that's in our COVID-19 toolbox, okay? They have been shown, as I said, to be highly effective, but we need to continue our other preventive measures, and those include, as I said, washing your hands, avoiding close contact, covering your nose and mouth with a mask, cleaning and disinfecting surfaces frequently, and staying at least 6 feet away. Stopping this pandemic requires us to use all of the tools in our toolbox. And so I can only emphasize, I can't emphasize enough how important it is that we continue to do that. It will take time for everybody to be vaccinated. And because of that, there are going to be people who have not been vaccinated, and therefore we will need to make sure that we are protecting them by not exposing them. That's why these things continue to be important. So the COVID-19 can, the vaccination can protect you. It can protect your family, it can protect your friends, it can protect your community. So it's important for all of us to be vaccinated. You need to choose to get vaccinated. You need to participate in that application that I talked about, the vSafe, so that will help the CDC do the monitoring so that we are aware and get better understanding of the virus, of the vaccine. You want to share your experience with your coworkers, with your friends, with your families, so that they can see that you have gotten the vaccine, that you're supporting this, that you're supporting the health of the community, and you want them to do it too. You have a role in increasing the confidence in the COVID-19 vaccination and in sharing your experience. And in doing that, you will influence others. Okay, so now we're going to talk a little bit about how to get vaccinated. So today, currently, based on what the New York State guidelines are, you can get vaccinated if you are a healthcare worker, if you work in a healthcare setting, if you are an essential worker, a teacher, you work in fire or police, if you're transit workers, if you work in grocery stores, anything that's been designated as an essential service. If you are 65 years of age or older, that's considered a vulnerable population. Or if you have certain diseases which also would indicate that you may be more prone to having serious disease should you get infected. Those are listed here. Some of those are listed here on the slide. They include cancer, kidney disease, lung disease, heart conditions such as heart attacks or heart failure. Severe obesity has been found to be a predisposing factor for more severe disease. If you have sickle cell disease or thalassemia, diabetes, cerebrovascular disease, which is like strokes or mini strokes or TIAs, other neurologic conditions such as an Alzheimer's disease or dementia, or liver disease. All of these are predisposing factors to having severe disease, and therefore New York State and the CDC have recommended that these people get vaccinated early and are eligible for it now. So where and when can you get your vaccine? Well, right now there is a limited supply. The county and state both have sites where they are giving the vaccine, which you can access through a computer, and you can register them online. You can contact the center if you want a vaccine, and they will reach out to you when the sites are available. The vaccine is available on a week-to-week basis, and so we are never 100% certain of when we're going to be getting the vaccine. The bad weather that occurred around the country last week was an example. It actually caused delays in vaccine delivery across the country. And so you can never be 100% certain, but it is something that they're trying to manage to get it as smooth as possible. We encourage your family and your friends to schedule a time for the vaccine. Again, it's a giant step toward getting back toward normal. The federal government provides the vaccine free of charge to anybody who's living in the United States. And if you have questions about your health or about the vaccination, certainly I would recommend that you reach out to the CDC website or anything like that. I also strongly recommend that you reach out to your own personal doctor, nurse, or clinic so that they can answer specific questions about you related to your particular health situation. After the vaccination, like I said, it's not uncommon to have a sore arm. It's not uncommon to have some body aches, potentially to have fevers. If you do experience a fever after the vaccination, we do recommend that you stay home from work if you can. Okay, so this is why, because you will be asked questions when you get the vaccine of have you been sick recently, have you been exposed that you know of, and the answers, and they'll take your temperature, and the answers may be no, but it doesn't mean that you haven't been exposed. And just because you got the vaccine, say on a Monday, doesn't mean that if you were exposed on the last Friday that you might actually develop COVID before the vaccine can actually get to work. So you should, if you start to have the symptoms of COVID, then you should do everything to make sure that you're protecting yourself and protecting everybody else. The CDC, I've talked to you about the CDC app, the VSafe and the VAERS, the Vaccine Adverse Event Reporting System. I strongly encourage you to participate in those when you get your vaccine, because that will help you also. And it will help all of us understand better exactly how these vaccines are, so that we can better and continue to educate everybody. So that's all that I have. I'm very willing to answer whatever questions anybody may have.
Well, first of all, I'd like to thank you for the time and for providing us with such useful and extremely valuable information. And we already have a couple of questions in the chat box, and I'm just gonna go ahead and read them out loud. So the first question was from Lizanne. Pregnant women are included in the new group. Women in this group are hesitant to get the vaccine. What are the effects on the unborn child?
Yeah, so that's a great question, and it is a question that is asked often. So the original studies did not include people who were known to be pregnant. However, there were some people who were not known to be pregnant, but actually were pregnant when they got the vaccine. It was not a huge number, okay, but it was both in the Pfizer and in the Moderna, and they did not see any ill effects on the developing child or on the pregnancy related to the vaccine. I will tell you that women who get the disease who are pregnant are more likely to have severe disease, and so that is one of the risk factors for having a severe disease. So if for any individual, any woman who is pregnant, I strongly encourage them to have a conversation with their doctor, with their primary doctor, or with their obstetrician to talk about the risks and the benefits as they are known in making the decision about getting vaccinated.
Awesome. Thank you so much. Our next question is from Pavel. Is it true that people had very bad life-threatening side effects after they received second vaccine?
So again, as I said, the vaccine, the second dose does tend to give you side effects that are more intense. They are not life-threatening. They are uncomfortable, certainly. Like I said, the discomfort at the injection site may be a little more intense than after the first one. The body aches, the fevers may be a little more intense, but they are not life-threatening, and there has been no obvious or consistent problem with people getting the vaccine and being sick to the point of needing to be admitted to the hospital.
Thank you so much, Doctor. And our next question is, okay, how people can get some kind of international vaccination passport for traveling outside of the US. Some other countries have this, so people started to ask here.
Yeah.
Mm-hmm.
Yeah, so no, that is a great question. It is something that is actually being looked at. Right now, there is no process like that within the United States. But I do know that both that state governments and the federal government are looking at what a vaccine passport might be. I will tell you that when you get your vaccination, you will get a card that will say, you know, that you got the vaccine, the date that you got it, which vaccine you got, both the dose and the second dose. And you can keep that with you. You can keep it, you know, in your purse or in your wallet, so that if somebody asks you, you can answer that question. But right now, there is no definite program for that.
Thank you, doctor. And our next question is, how long after having COVID-19 should a person get vaccinated?
So the current recommendation is that if you had COVID-19, you can wait up to 90 days before getting vaccinated, okay? The reason for that is because we know that the natural immunity from the disease lasts at least 90 days. And because you have that natural immunity, that another person who does not have that may benefit from getting the vaccine sooner. That does not mean you should not be vaccinated. If you have the opportunity, if you're in one of those groups and you had the disease and it was 30 days ago, 60 days ago, it is still okay for you to get the vaccine. And I would not pass up the opportunity if it is given to you.
Thank you, doctor. And thank you, Lizanne, for the question. Our next question is from Shelley Callahan. Why is it important that as many people as possible in the community get vaccinated?
Yeah, oh, that's a fantastic question. So I'm sure that people have heard about this thing called herd immunity. So herd immunity basically means that enough people are immune from the disease that the disease can't take hold within that population and propagate. So for the best information that we have, and this is still being investigated, but the best information that we have is that if somewhere between 65 and 80% of the population are immune, either through natural disease or even better through the vaccine, then the virus can't take hold and spread from one person to another because it keeps hitting these roadblocks of people that it can't infect. And it's the infection. The virus, basically, the only thing that it wants to do is to make copies of itself so that it can continue to spread. And if we can stop that through this herd immunity, then even the 10% or 15% or 20% that have not been vaccinated still get protection because of the herd immunity. They don't get protection if they actually are infected or come in contact with it, but it significantly decreases the likelihood that they will come in contact with it.
Great. Thank you so much, doctor. Thank you, Shelley, for the question. And our next question is from Lupway. Is it safe to take the vaccine if you are generally weak from your older age with some medical condition like arthritis, hypertension, diabetes, and etc.?
So yes, and in fact, I would say that is the population. That is exactly the person that should be getting this vaccine first, because it doesn't give you the disease. It does stimulate your immune response actually better than getting the disease itself does, and so your ability to fight off the virus should you come in contact with it is much better. So yes, that person that you just described should absolutely be first in line to get the vaccine.
Thank you, doctor. And thank you, Lupe, for the question. Our next question is from Marut. So do we need to get vaccinated twice a year or even more if the vaccination doesn't last longer than 90 days?
Yeah, so that's a great question. Right now, we don't know. We do know that the vaccination lasts longer than 90 days. 90 days is the first iteration. Remember, the first people to be vaccinated, other than the 30, 40, 50,000 that were in the original pilot, have only been vaccinated since middle of December. So it's only been a couple months. since we started this process on a large scale. We do know that the people that were in the pilot, initially we said 90 days because that was the time frame from the time that they were given the vaccine until the time that the FDA gave their emergency use utilization, their EUA, emergency utilization authorization for the vaccine. But now we know that it has extended beyond that to even 5 or 6 months, because that's been how long. We do not know how long it will last, whether it will be a year or 2 years or the rest of your life, which is why people are saying we may need to get a booster shot, similar to what we do with the flu, similar to what we do with some of the childhood immunizations. That's just information that is not available to us yet, but we are watching for it.
Thank you, doctor, and thank you, Margaret, for the question. Our next question is from Lizanne. Why does the vaccine provide better protection than heavy COVID-19?
So that, again, another great question. So the ability or the amount of defense that your body makes from the natural disease is dependent on how sick you get and how much virus it is exposed to. So if you get exposed to a small amount of virus and your body immediately can kind of wall it off and keep it from getting inside of you, then your body doesn't have the need to develop the full defense mechanisms. Whereas when you get the vaccination, then you're actually getting a set amount. It's getting into your body. Your body is immediately seeing it, immediately mobilizing all of its defenses and making those antibodies so that it will respond when it sees it again. And so it's really it's because of the variability in when people are exposed to the virus itself, in terms of how much of a defense they will make, that the vaccine seems to be better.
Great, thank you so much. Doctor, also one of our presenters mentioned that during the presentation, you mentioned a link to activate once one gets vaccinated, not the application, but the link.
Yeah, so that is probably the VAERS system, which is not an app, it's actually a website. And so I don't know exactly what that link is, but it is available to you. I think it's on the MV Health System website, so you might look there. You can certainly go to the CDC website. I know it's there.
Mm-hmm. Thank you so much. Thank you. And I don't see, okay, let me see. It looks like there's one. Okay, you received the link after the vaccination. It was a comment. Okay, one of our attendees today got 2 vaccines and she'd like to share her experience. So, and this way she can encourage more people to get vaccinated. Natasha, you're welcome to the floor, and we're happy that you want to share your experience with us.
Thank you so much. I'm glad I can help. Can you hear me?
Yes.
Okay. I received both dosages. Last Thursday was my second one. From the first one, I just got headache next day, not even pain in my arm. And from the second one, I did get a little bit sick, like lower fever, 99.9. And muscle pain. I called in, I didn't go to work, and I didn't feel good. And headache, it only lasted 24 hours. Out of 13 of us that received 2 vaccinations so far, only 3 of us had these symptoms. So I feel like it was worth for 24 hours, better getting those symptoms than COVID. And, I did participated in V-Safe check-in because I really feel it is important for the future research for everybody to know about the side effects. I encourage everybody at work. I am a support staff in a licensed daycare, so that's how I had a chance to get vaccine. A lot of people weren't sure, so I scheduled many people for their appointments. So I volunteered to sit on a computer. If that's going to bring us out of this pandemic. It's very important that we advocate for it, that we share our experiences. So we had opportunity, our childcare centers, for staff to receive vaccine. And I feel it is important, like herd immunity is very important. And all the questions were really good questions. I was taking some notes. So I will encourage everybody that, take a vaccine. Like I feel I personally didn't get COVID, anyone in my home didn't get it. So I felt like if we lasted this long, our obligation is to get vaccinated to support our little kids who are not going to get vaccines. So if that's what we can do, still having a mask, social distancing, that's very important. So I would encourage everybody, when your chance is to get vaccine, please do it.
Thank you so much, Natasha. I really appreciate it. Doctor, we do have a few more questions. So I'm just gonna read them out loud. The misinformation or myth about the vaccine has been spreading like a wildfire in our current community. The majority of our seniors, they're not to take the vaccine despite our effort to give them accurate information. Do you have any suggestion on what can we do better?
So I think, I think what Natasha just did is really one of the best things. If there are members of your community that have gotten the vaccine, and they can, and because they're members of the community, they're going to be trusted more than I will, honestly. And so have them go to people and say, hey, I got the vaccine. I had a mild reaction, but now I feel fine. It is not something to be scared of. It is something to understand, absolutely, but it is not something to be afraid of. In fact, it is the thing that will get us to the other side of this pandemic in as quick a time frame as possible.
Thank you, Doctor. Another question from Shahla: should both doses be of the same vaccine?
Yes, actually, that is one of the requirements, is that if you get the Pfizer vaccine as the first dose, you should get the Pfizer as a second dose, and Moderna. That is how the dosing regimen was made. And so even though they're both messenger RNA vaccines, they were made slightly differently, two different companies. And so, you should get the second dose of the same vaccine. I will say that, you are usually, I think it's 100% of the time, but I always get a little scary when I say 100% of the time, that you're actually given your appointment for the second dose after when you go in to get the first dose.
Yes,
so
you're right. They schedule you at the same time in 3 weeks. I got Pfizer. So yes, they schedule you at the same time. So it's very well organized. Nothing I ever seen in my life, like very well organized.
Thank you, Doctor. Thank you, Natasha. Another question: how about children's vaccination?
Yeah, so the original studies looking at the safety and the effectiveness did not include children. They included in one group, I can't remember which was which, but in one they didn't include anybody under 18, and in the other one they didn't include anybody under 16. There are now currently studies that are going on to look at children getting the vaccine, and at what age, is it safe? Because first you want to know, is it safe? And then you want to know if it's effective. If you can answer both questions at the same time, then that's great. The anticipation is that we will have that information probably by sometime midsummer, possibly sooner, but probably by sometime midsummer we should know that. And then it will go back to the same process to the ACIP and then to the FDA for evaluation and ultimately approval or not approval.
Thank you, doctor. And there also has been a comment to our previous question, whether one should schedule their appointment right then at the same time when he's getting his first vaccine. So Yvonne commented that on occasion, had the person schedule their second vaccine remotely. Okay, so
Okay.
so there's looks like there are two options.
Mhm.
Thank you so much, Yvonne. Are there any more questions? If there are, please feel free to unmute yourself and speak out loud or put them in a chat box below. Meanwhile, I want to thank our doctor once again. So many extremely valuable information that all of us are needed at this time. So many great questions. Thank you very much for giving us such detailed and clear answer to those questions. I hope that this education workshop will encourage more people to get vaccinated, as well as reduce the resistance to the vaccine in our community. So we will be able to get back to our normal life. I miss seeing everybody at the office. I miss hugging people. I miss just, giving a handshake. So hopefully this workshop will really help us and our community. Again, thank you so much, everyone, for joining us today, and I hope you enjoy the rest of your day. If you do have any questions, though, please feel free to reach out to us, to the center. We will be able to answer your question, and if we're not, we will make sure to ask the doctor to consult us on this. So again, enjoy the rest of your day and stay safe and healthy. And we are the Office for New Americans, and see you next time. Thank you, everybody.
Thank you, everybody. Take care. Be safe.
Thank you.